All right, so today on the show we have Doctor. Do you like it when people say Doctor? Doctor Michelle Boland?
Not many people in my life say that. I was actually called Worcester in college, so that, like, feels good when I hear that, so feel free. No,
Yeah, I mean, you worked hard enough for it. Like, I'm gonna call you
yeah, I'm
Doctor.
just kidding.
Yeah.
Alright, go for
But
it.
no, thank you so much for being on the show. I know we've kind of chatted a little bit about some interesting things, Jordan Peterson and all that right off the bat.
Mhm.
But now that we're officially recording, if you don't mind just kind of introducing yourself, give everyone the elevator pitch, if you would.
Yeah, of course, thanks for having me, Kyle. I really look forward to, this conversation, but also conversations moving forward. So for people who aren't too familiar, my name is Michelle Boland. I currently own my own training slash fitness company called Michelle Boland Training. And I came from a pretty academic background. I guess you could say it's like a typical stumble through life and figure out like what you want to do and what you don't want to do. Of like, I was in school, I love school. If I could stay in that environment, I probably would as a student. Um, but I was on track to become a professor. And, I just absolutely I had a few kind of adjunct teaching positions, graduate assistant, and I was like, yeah, I don't think this is for me. And prior to that, I was in nutrition. So I got my undergrad in nutrition and I was like, oh, this is going to be great. And then I worked for a dietitian, went through kind of a few career experiences of that. And I was like, no, we're moving on. And then I went to a program for strength and conditioning and then exercise physiology, where I finally got my doctorate in. And then I went and worked at a D1 collegiate setting for strength and conditioning at Northeastern University, which is just absolutely amazing. And then I got an offer to be director of education at a private facility. And then the next step was basically working for myself and starting my own thing. So that's kind of where I am now.
Gotcha. Jack of all trades in a way. I'm
I
curious.
try.
Yeah, I'm curious how I mean, do you still use? I'm sure you use a ton of your nutrition background, like
You
in
know
the
what?
private setting, right?
Yeah, so the program that I was in was very clinical. It
Gotcha.
was feeding tubes to people in hospitals and yeah, so like in diabetes and disease states. So that's probably why I don't really do a lot in nutrition. I'm kind of in the mindset, I think when I was young, I probably tried to do a little bit here and there. But I'm kind of in the mindset now of if I don't feel like I'm a true expert or can make a big difference in someone's life in a particular subject, I like to have like a referral basis. So if someone needs nutrition, I usually try to partner with someone else for that.
Gotcha. Okay. Is that just how? Are there like separate types of like dietitian or nutrition programs at universities like that, or like where you go
So
more clinical or private? I guess.
I don't know too much, but I wanted to be a registered dietitian, and maybe it's just my experiences were all very clinical. I'm sure you could have gotten like a internship for your dietary internship at like a sports nutrition place and kind of expanded your horizons kind of in that way. It's just the same as like I don't know, a physical therapy internship, like you can
Yeah.
kind of choose. Hopefully, you're in a program where you can choose. I think my just experience was way more clinical.
Gotcha. Yeah, that's what it reminded me of because like going through physical
Yeah.
therapy programs, it's like you get placed into a SNF or skilled nursing facility or a hospital, and then you might have another rotation, which is outpatient or something
Hmm.
like that. But no, I wasn't familiar with that when it came to dietitian. Or are you registered or
No, no, that
no?
is like
You just cut
was
it
an
out.
that was an astronomical process of like
Uh,
getting an internship and then going through like a whole different school set. That's like really hard to do to get your RD.
yeah, I'm all about like trying to shorten those things as excuse me as much as possible. So I it's not fun going through the system and the bureaucracy at times, but I totally get it.
Yeah.
But I I am curious as to, and we're just going to kind of dive right into this bit, especially with your
Let's go.
experience going through, academia, but trying to take this knowledge base and, probably talking to anyone who's listening to this, if they're either a trainer, probably a trainer, if anyone's listening to this, if we're being honest,
Fair.
uh, but probably for anyone, but taking that, plethora of knowledge and what you learned in school and then honing it down into a skill set into where you can look at someone and like they need X, Y, and Z and you don't even have to think twice. It's just kind of like running through the motions and sort of what you have found to be beneficial in that process.
Yeah, that's actually a very interesting question. So I actually have a lot of problems with like some academic institutions, or probably most academic institutions these days. Or it's like
Most of them.
most. My particular experience, and I probably should just speak about that, and not
Mm,
my overall opinion of it. But I think at a very high level of academia, I was in a program that the head person was someone who only wanted to hear what was coming out of his mouth. He didn't really want you to think outside of the box or have discussions. And overall, I think that's the one place really that should be promoting you to think and discover and explore, and teach you how to set up ways in which to think. So, I have a course now called the strategy course where I've really tried to teach people the best ways on how to do that. Like how to create, like you said, how do you make decisions? Like, do you have maybe a step by step process that you can kind of prompt questions to yourself to lead you in a specific like solution? Um, do you have kind of a mind map where you take yourself through, a whole process with someone that you're working with? And I think, you know, some physical therapy programs I've actually saw that like do a great job of that. But I think that's what's probably missing from a lot of academic institutions, and just basic like organizational and like learning skills. Um, so I think that's what I've probably tried to extract the most out of my experiences of like look, everything's easier when you look back. We can always like say there's problems with things, but really it's like, can you look back and find solutions moving forward? That's the only thing that matters. So how can I maybe extract that and incorporate this into how I'm providing education to like trainers moving forward, right? Can I teach them ways in which to organize these skills? Because kind of like what you inferred of like, especially like this day and age, there's like online education is like one of the biggest mediums, right? For continuing education for professionals, and we're learning so much, and there's all these like biomechanical information, and it's like, okay, like, do you have the skills to know what to do with that information and apply it and turn it into knowledge, which is different than information? There's an application process to that and an experience process to that. And I think maybe that's a big gap for people, right? Taking in information and then actually like knowing what to do with it.
I think too, it's when I think about fitness and even rehab in a lot of senses, I mean, at least with rehab, you get like a clinical instructor or you have some of these rotations. But fitness, it's like you take a cert or you take a test, you get a cert, and then you show up at a gym and you have, maybe someone who's in charge, a manager who's more concerned about sales than they are, actually helping like clients and get them achieving goals. And obviously, like that's important to them, but the gym's got to
Mhm.
survive in a lot of ways. But there's a lot of leadership and mentorship that is missing in fitness. And I think with fitness, it's sort of grown along with the internet. And now we're finally at this point where, because of COVID, like you said, there's these continuing education outlets, which is great. And you can actually
Mhm.
meet these people. You don't have to, I don't have to, where are you located? I'm sorry.
Boston.
That's right. I don't have to drive all the way up to
Yeah.
Boston to come hang out with you for a weekend. It's like, okay, we can actually
Mhm.
foster this true, like you said, leadership or expedite of knowledge and how we can actually help more people. And the
Exactly.
past 10 years, we didn't have that. It was just, it's always been the Wild West with fitness,
Yeah,
right?
exactly.
There's so much information out there, but now we have that leadership, I think, that's in place. And it makes me actually excited for the next 10 years and what can come from that.
Yeah, and it's also like obviously there's fitness information of like how to coach better and how to get
Mhm.
results from your clients, which of course is greatly important. But like you said, in terms of like the leadership, it's also we're also seeing a lot of like empowerment in terms of how to make more money, like how to improve sales, how to interact with people better. And I think creating better business people is actually a great help to pushing the industry forward because we need to push our price points a little bit higher because like we're worth that and the field is just so young that we're probably not as valued as we could be. So I think that part of it too is actually extremely helpful.
Yeah. I remember my first job at a big box gym, and it was in Seattle, and I was making $25 per session, which I was like, oh
Mhm.
wow, that's pretty good.
Yeah, right.
And then I look at how much they're charging for each individual session, and it was like $100. So I'm getting
Mhm.
a quarter of this. I was like, I get they have
Man,
the
it's so
gym,
good.
but yeah, it's just like, but I'm the one providing the skill set. So
Mhm.
why is it that I can't charge this much for my skill set? Like obviously I'm here, but at the same time, like it's fitness. I could go to a park, and I actually did that. I was just like trading people at the park a lot of the times on the side and taking them. But that was something I realized really quickly. It's like, okay, but people get stuck in that mind frame, and then they look at online and they're like, oh, I'll just charge $25 a session online.
Mhm.
And
Yeah, but you have to have this like entrepreneur mindset, right? And you probably have that of like, okay, well, I can do it better, or like,
mhm,
oh, I see what's going on here in terms of like how they're running things in like a good or bad way, and then your mind is already thinking like, oh, what you can do better and how to like maybe better that in the future. And some people just don't think that way. I mean, that's probably one of the reasons I started my own thing because like I ran into kind of the same problem as you. And also too, like especially like in academics, like there's accreditation programs where they kind of drive one profession, right? So you have like strength and conditioning programs pushing, working at the pro level and collegiate setting is the ideal. Like that's when you know you're gonna make it. But that's when you're working like 16 hours a day, traveling X amount of weeks per year, not making that much money at
no,
all. Like I know some collegiate programs full time who pay $30,000. I mean, it's like, why are we going through like a master strength conditioning program to get these positions? So it's like, if we can kind of change that mindset in
mhm,
terms of like the money that we're making, what we're worth, I think that's when we make like the biggest jumps.
for sure. Well, and I tell new trainers all the time, I'm like, if you can
Mhm.
actually get someone to adhere and you can make the behavior change of just thinking that exercise is fun and that they should do it at least 3 times a week, you just gave that person probably 10 years of their life,
Yeah.
right? And then if you think
That's
of
so
that,
hard to sell.
no, it's terrible. You can't sell that, but it's more like I think a frame of reference, like to think about like your own services that you're providing. You get
Mhm.
someone that
Oh,
wants to
yeah,
nickel and dime, and it's like, listen, if you really want to think about this, like if you were on your deathbed and I could offer you 10, 10 years of your life, you pay anything,
for sure. For
right?
sure.
But like you said, it's hard to sell. You can't think that far in a lot of
Oh,
ways.
yeah.
But
And
yeah, the
especially in
whole
terms of, like, the medical system, like, we could fill,
right.
like, a huge gap with that, you know?
Mhm. It's it's a whole nother topic of discussion, and it gets depressing very quick. So we're gonna pivot a
It's
little bit.
great.
Yeah.
So sorry.
No, again, it's just something I like to just tell people. It's like, listen, like this is huge. It's a huge benefit, and it's one thing that can drive you to make more money, start your own business. But it's another thing that you can do that while helping people and ensure your own health. It's kind of a
Mm.
best of both or three
Win-win.
worlds if you want, right? But kind of to pivot from that, so we talked a little bit about taking that skill or forming a skill set. And one thing I do notice with a lot of what you post and your exercise database that you have is that you are doing all kinds of different movements. If you want to definitely expand on the database a bit, but I'm curious of your use of constraints and some of the things. If you want to define a constraint for the listeners first, but also maybe some of your favorite tools and moves that you've been playing around with.
Yeah, of course. No, thank you for that. Yeah, I just turned my database into like a digital online app platform, and
Yeah.
it's just it makes I was talking to the guy who, built it for me, and I was like, I just wrote a program in like half the time. I was like, this is insane. I was like, this is awesome. And it's basically like, I have people from all over the country who I write training programs for. And, if I'm programming a front foot elevated, right racked, reach, split squat, if I was them, I would read that and be like, what are you talking about? Like, what is going on? So, like, I need to provide them visuals efficiently that will show them exactly what that is. Um, so yeah, just even just the name of that exercise, I would say there's just so much variation that you can put in with an exercise based on like your intent. What arm you want reaching? Do you want a certain foot or side elevated? What are you trying to accomplish? And the details matter with that. I organize specifically the database in terms of planes of movement. But then also there's kind of an implication of teaching, like, what are you teaching someone, like, the more slower activities, um, versus when are you loading someone, and actually applying, like, adaptations and fitness qualities. So I guess my approach to that would be really, I want to teach people to be able to have skills to move from leg to leg and side to side. And that's all different types of directions and ways of moving. So you have to have both access to those motions, learn skills, and then also what we consider fitness quality improvements, like adaptations. So that's kind of like my maybe mindset towards, like, exercise selection.
Mhm.
Hopefully that answered your question.
Well, I guess could we like unpack those individually a
Okay.
little bit? Because you're in two, because you're talking about access and skill set and then adaptation, and like that makes sense. But I guess maybe like an example.
Oh, yeah, and then constraints, yeah. Sometimes I black out on podcasts, but
Oh, that's fine. I
yeah.
threw a bunch at you on
Yeah.
that question.
So, with constraint first is more probably something that's passively put in place to allow someone to accomplish a task. So, for example, if I don't want someone bending to the right or dumping their weight out to the right, maybe I put my hand on their right side or right side of their hip and say, "Hey, don't touch my hand." Or I use a foam roller to push into the wall to keep someone's position, or a bench in a certain incline, doing maybe like a chest supported row, um, or they have to reach towards a specific object. So it's like it's put in place almost to like improve your coaching, not from a verbal sense or a cueing sense, but almost just like just put this in the way and then
Yeah.
they'll just be able to do it a lot better.
Right. I I've always thought of it too. I think of like an amoeba, and how like an amoeba moves and it kind of like puts half of its body and reaches out and then it pulls itself. It's
That's a
like,
good analogy. Yeah.
yeah, and well, like it's weird to think of the body as that in some way. You put your foot out and then you take a step, but it's I guess a constraint to me is like, how can I put like a little box around that amoeba so that it goes
That
one
yeah.
direction? in
That makes
comparison.
perfect sense.
Yeah,
Yeah, and it's almost like this it's more in some ways, I think it's a little bit more external because like a
right,
reference would probably be a little bit more internal.
right. Well, and I think it too, it just makes more sense for the person doing the activity, especially when they're doing a higher level activity. It's like the last thing you want to think about is consciously squeezing something or
Yeah.
trying to leverage something. So if you can just passively, and two, like with the way the body adapting to the environment, if we think of dynamic systems theory, just like let's put something in the environment that is going to have an effect on you so that way you move a little bit different.
Exactly, and that's probably the biggest difference, like the thinking aspect in terms of like learning something and then just straight out outputs, right?
Hmm.
It's
Yeah,
like, yeah, if you want an output like successfully, maybe in a specific task, like you want someone to be able to do something, yeah, provide constraints so they're not like thinking about what they're doing.
exactly. Well, and to make it like unconscious, I guess. Like that's
Yeah, it's a
that's
good
what I
point.
think a lot of people forget about. It's like, you can pull your shoulders back all day, but like, is it really going to carry over into like an unconscious action?
Yeah,
And I guess,
yeah, that's a
would
good
you like
point.
to find that as like an adaptation?
What, making it an unconscious
Yes.
action? Hmm. Yes, from maybe a, like a neurological
Hmm.
perspective. Um, yeah, I would say so.
Yeah.
That makes sense.
I'm curious too, is like, when we're just kind of riffing off of adaptations, but when I think of muscle, like neurological inputs, and then like position of joints, right? And then the leverage that happens on a muscle, we're getting deep. But
It's okay.
I'm just curious, like, what you're like, how do you kind of sort through that? Like, okay, this muscle may not be getting a proper leverage because of the joint position.
Yep.
So I guess the question I'm trying to ask is like, how do you play around with like a constraint to then get a better like leverage of that muscle? Does that make sense?
Yeah, I would probably say that's a great conversation. It's like, where do I want to take this a little bit? I
Yeah.
would say, what joint ranges of motion is this person currently capable of? So say we'll just shoulder flexion,
Mhm.
right? And if I say, um, right above their shoulder, so straight out and then right above, and not beyond is what this person is capable of doing for that. You could, and this is again a difficult thing of, do you really want to make that clear to your client? I am kind of on the side right now where I don't make that clear to
Mhm.
them. Like, hey, like you're not able to raise your arm over your head. You don't have that range of motion. I don't really like talking to people that way. So in terms of your reference, you would provide a constraint. Like have something if they're doing like a overhead pull back or something like that, have something behind them that cuts them off from going past that joint range of motion and stay within the range in which they're kind of currently capable of doing. And yeah, I would say anything kind of going beyond that, you're maybe asking them to go into a situation where they're gonna recruit something else to be able to perform that.
Mhm.
In terms of joint position or bone position affecting like muscles. Yeah, this is where like a good kind of in-depth understanding of anatomy. And I credit like the Posture Restoration Institute a lot with this kind of information of, when you hear someone who has tight hamstrings or you're teaching, this happened to me the other day, teaching um, a 16-year-old how to hip hinge and I knew visually,
That's tough to
like,
do.
my yeah, yeah, exactly, thank you.
Like,
Like, visually, I could see it. I knew it was going on, but, like, I'm not gonna tell that individual. Instead, I asked her, like, "Hey, how'd that feel? Where'd you feel that?" And, of course, like, she matched my visual representation was going on of, like, "Oh, I just felt like my hamstrings were pulling apart," right? And
mhm.
that's where I'm kind of taking information in. It's like, "Okay, the pelvis, right? If we change the position of the pelvis, if we she was kind of like bending at the hips instead of like pushing the hips back. So this is after like months of working with this individual. First, I would teach the stacked position and what that feels like first of like keeping the ribs on top of the hips. And the squat is what we focused on first, going straight down, straight up. And then I kind of wanted her to get the sense of keeping that stacked position, that like cylinder, and now moving it backwards in space, but not breaking that apart. And that presented a difficult challenge for her. Um, but I think she needs to learn that first, then to be able to carry that out. But yeah, we made some changes. She got a lot better, felt her glutes, didn't feel this like extraordinary pull in her hamstring. Um, and so I think we got the hips, back a little bit, like
Hmm.
reposition where the bones were, but also the execution part of that. Um, but yeah, thinking about joint position, especially proximally, kind of to round about your question, and then joint range of motion is going to allow us to be able to target muscles a lot better with the exercises that we select in the
Yeah.
most roundabout way possible to answer that question.
Well, you made a post and it was saying like allow the movement versus like squeezing
Mm,
to get this activation. And I think that fits
yeah.
perfectly into, the idea of using constraints because I can't tell you how many clients back in the day where I was like, "Oh, get your lat." And I would tap on their lats and be like, "Squeeze, just squeeze it as hard as you could." And I
Mhm.
think back and I'm like, were they actually using their lats for the movement or were they just squeezing the crap out of their lats the whole time? And they
That's a
felt like
great point.
right. And
Yeah.
I couldn't tell you honestly. And well, if I think of joint position and all that, they probably weren't to some degree. It was probably some other like muscles kicking in, and that's why they were having the problems initially. But yeah, I guess if you want to try to dive into your own quote, I just quoted you,
I
like
love it.
allowing this movement to occur.
Yeah. I think that was in reference to a chest fly. So someone's
Mhm.
laying on a bench, 2 dumbbells in their hand. The dumbbells come out wide with their hands and back in. Now, this is something that I think goes into the realm of intent, right? Because if I have, I mean, I think this example is terrible, but I don't know. Say hypothetically, you have like a bodybuilder, right, who wants to create hypertrophy in their pecs, right? Like you probably do want a lot of compression to be happening because that's what their goal is, right? To squeeze harder, like their whole body as a whole to move weights, they have to be good squeezers. And when they perform a chest fly, they're probably trying to squeeze those pec muscles. They're probably doing it at a very high weight. Um, but on the flip side of that, if your intent is movement, which I try to specifically use that word, then I want to create some expansion to allow space to open up. And I would really choose the chest fly in a warm up routine with someone who I want them to take a breath of air in, allowing movement into their upper chest. And so the weight's going to be low. But again, if that's my intent, I have to make sure I coach it in terms of inhale as you come out and try to be relaxed, not squeezing your pecs together and all tight. Allow your chest to open up and then come back in with that exhale. So I think it's just like a matter of what your intent is and making sure that if you're allowing movement to happen, same thing as kind of maybe a hinge of like, I don't want someone to squeeze their glutes. I want them to probably inhale and feel like their backside opening up. Some people I work with feel like a little bit of a stretch sensation um, in their glutes, like performing like a trap bar deadlift and things like that. And that's allowing them to kind of push back in space instead of maybe that squeeze, which is probably going to push them forward a little bit.
Right. Or lock them in a position and they use
Exactly.
something else to get the movement to actually happen.
For sure, for sure. If you're just squeezing your butt, like, in a like a deadlift position, your weight's probably forward,
Mhm.
right? And you're probably gonna initiate that movement from like a back coming up first or like a chest coming up first.
Right. Or you see those people who deadlift with their knees super wide. Not a sumo, but like just like externally rotated, like hips the whole way. I've seen
Yeah,
some
like
interesting.
knees come out.
Right. No, it, it's hard too to think of this. I'm curious your definition of the term that the word movement and how you're talking about that.
Mm.
Right. Like if you could try to dive into that for everybody, because I think of movement, I just think of movement, right? But what does that mean to you?
That wow, that is a very philosophical question. It's amazing.
Perfect.
Um, I probably get it's funny how like your lens can kind of transform over time. I think overall I've been very highly influenced by the Posture Restoration Institute, like taken 12 courses, like they've changed my whole perspective on like anatomy and like how the body moves. And then I attended Bill Hartman's intensive, which I highly encourage people to apply for. And he then again changed my whole idea of movement. But I never like to become something. So like I'm never going to like dive into a school of thought and just become that school of thought.
Mhm.
So I think my idea of movement maybe is like a blend of everything. And when I hear movement, I think expansion. So like a space has to open up to allow um uh joint range of motion to occur. I was trying not to say the word movement for the definition. But so if I'm doing a hip hinge and I'm pushing my hips back, well, the backside of my hips need to create expansion and open up to allow that movement to occur backwards. Same thing for a press. Like if I have to push my arm forward, areas of my body have to open up. If I need to be nice and still and restrict movement, it's going to be the opposite. I'm going to squeeze, I'm going to compress. I'm not going to, I'm going to close space, is what that is going to do. And I'm not saying that this is Bill Hartman's school of thought for sure, not,
Mhm.
but that's kind of like how I've really changed my maybe definition or how I view like all the movements that I watch people do.
Gotcha. I because I I agree with that mindset just in the same way. Like if I do, I guess a compound lift, that's the only though it is still a movement, it's going to have
Mhm.
less movement to it in a way. Like it's well, and I guess I've been using terms like rotation and anti-rotation.
Okay, that makes sense.
Yeah, whereas like a compound lift, you don't want a lot of rotation to occur because you're just trying to lift that weight in one direction. Whereas maybe I do an accessory movement that'll have more potential like rotation to it. So like a split squat variation and with a cable constraint or something like that. We're trying to go, it's just has more rotation to it. Maybe
Yeah.
specifically at one joint over the other.
So like a freedom of movement. And
Yes, exactly.
right, so like if you're doing a cable chop, it's like you're probably a lot more relaxed. You're probably going into a lot more rotation as like that band. I'm assuming it's from a high to low position
Mhm.
coming across your body. You want like joints to turn over each other, like your upper body to like disassociate from your lower body. But when you're squatting, especially with heavy weights, you don't want that. You
Not
wanna
at all.
stay in a straight up, straight down position, supporting that load on your body.
Mhm.
So, yeah, I mean, people use, um, different terminology for a lot of the same stuff. So if that's what you're basically we're probably could be talking about the exact same position, but you kinda say it in a different way.
Right.
But,
It's
yeah, I
just
mean, that makes sense.
how we conceptualize things in our own heads and trying to figure out what the heck is going on with the body. and watching, people move. It's that's why I like the use of the constraints. And like I said, I feel like you do a really good job, and you're posting all this stuff. I'm like, oh man, that's fantastic. Like I want to use that. And this looks really good and so much easier than me just telling someone, I need you to do this. Right. Like I
Yeah.
think that can just lead to so much frustration for both
Yes.
you as the coach and the client or the person or your buddy that you're exercising with. Like it's just it can be miserable.
Yeah, and especially on like a personal training basis of like one, there's like two extremes. I either have young adolescent, or excuse me, I shouldn't say young adolescents, but adolescents or adults. And adult, like people want to pay for obviously a good experience, but also someone who they look forward to coming to see, where they're going to have fun, right? And some people don't like that nitty-gritty that you're kind of
Mhm.
referring to. And especially over time, maybe you do have a client who really enjoys that. But over time, you know, you create friendships with a lot of people that you're working with because they do enjoy being around with you and having fun. You get to know each other's lives and you're having conversations why things are going on. It almost makes coaching easier if you are able to set someone up in a good position to allow them to execute it, but they can still kind of tell you about, their kid's wedding that was like last weekend or something and
Yeah.
not having them stop talking.
Right. It's not all about the movement itself, which I mean, I think in some cases that is good, but it should be a
Yes.
portion of the time of a session, if you would. Not every single exercise you're going into, but like you said, everyone's different in that way.
Yeah.
But I
And
think
it's
having go ahead.
sorry, no, it's good. It was just context specific, right? I think like some of the problem with maybe I could probably do a better job at this of like Instagram is like there's no context to it, right?
Right.
And like everyone sees like these fancy coaches on like, taped outside of session. It's not like a lot of people tape what's going on with the client because well, I know my clients wouldn't like that for sure.
Mhm.
And it's like perfect setup and they're explaining a ton of things. And like their demo person is always a trainer who has a good relationship and awareness of their body and makes it look so easy. And you're just like, well, why am I so dumb? Like, why can't I do that with your client? Meanwhile, you go to your session and they're talking about their dog and like this and that. And like you can't get them to listen to you. And it's like there's idealism and reality. And we need to make sure that a lot of these things can fit into our reality. And kind of like the point that you're referring to is like constraints can really bridge that gap in a way.
Well, it just meets the person where they're at, you
Yeah,
know. And
it's the
that's
easier
the
way to say it.
like yeah. Well, it's I don't know, we can go on and on probably about constraints, but I'm curious, like, what are some of your favorite tools that you're using right now? Like, obviously, like heel wedges are fantastic. Like, everyone uses those, but do you have any other like little tricks that you've been playing with?
Oh my goodness. What am I bringing out constantly?
Putting you on the spot.
I know. I wish I could think of this. It's always like
You need to look at the gym floor right now.
constantly doing.
You're like, oh, that.
um, yeah. uh, geez, you're killing me with that one.
Do you truly
Try,
use
yeah.
the what's the strap that you put around the shoulder and it wraps around the whole body?
What's it strap? That's actually the name. That wasn't a
What's it
question. That's
strap?
actually yeah. But yeah, I think it's like what's that strap is the actual name of the company.
Do you
I
use
think
that
it's
quite often?
I honestly don't use it as much as I thought I was gonna use it, to be
Yeah.
honest with you.
I was curious
Um,
'cause I see it especially, like, with all the people that post about golf stuff. Everyone's like, "You need this," and they, like, sit there and rotate with it all the time. I'm like, "I don't know."
yeah. It's it's a piece of equipment that's probably not necessary. It's just yeah, of course, you can, like, wrap it around someone and create, like, a rotational, like, resistance. You can
Mhm.
probably do that with a lot of other things.
Right.
A piece of equipment that I own that I pretty much use every session is the Anchor cable trainer. Are you
Okay.
familiar with that?
Yeah, yeah, yeah. If
Okay.
you don't mind kind of explaining what that looks like a little bit.
Yeah, so the Anchor trainer is basically when I first started working for myself, I rent space from a local gym. And the thing that I use a lot is a cable. Of
Mhm.
course, that's a huge thing in my training. And I was looking at what they, had to offer out there, and there was very expensive, very heavy, huge space filling cable trainers, like with stacks with weights, the Kaiser, which was way out of my price
Oh,
range.
yeah.
But then also I was working at a CrossFit gym and he was like, "Hey, like I don't really want like a huge piece of equipment here." And then
Mhm.
I got introduced to the cable trainer, and it's literally, man, it's probably 30, 40 pounds, the size of maybe my forearm, where there's different mounts. So you can actually make it a sliding mount on the wall. I have the one where it's a little bit of maybe a magnet and then like it straps around any pole. I brought
Mhm.
it out onto like fields and put it around like, a goal post, and it's worked
Wow.
magically. Yeah, I put it on racks in the gym, um, in my apartment complex gym. I'll put it around something, and there's like adjustable weights on the side. I've loved it just because it's super mobile. It was in my price range, and it works really effectively for what I do
Yeah.
with my people. And that's something that I'll put like the what's that strap on and give
Mhm.
some resistance.
Would you say you use a lot of like, majority of the do you spend a lot of time at the cable rack in general?
uh, I mean, it depends. Like if I have it, like I'll use it. Like I
Mhm.
have access to like a few facilities, but not no, not
Not
really.
really. I feel like once you kinda go down this rabbit hole, I found that when I was programming and even for myself, I was like, "Man, I'm just using cables like 50% of the time I'm at the gym." Like, trying to doing all this split squat variations, and I was like, "I need to get away from this. I'm just tired of using cables. They're, like, getting on my nerves."
Yeah,
But
you're probably everyone's like, "Oh, he's hogging the cable system
oh,
so
I know.
much."
Seriously, it was bad, but because like, I go to Crunch Fitness, and there's only these 2 little cable stations, and then, they got the big rig over here, and so I would
Uh-huh.
just sit on one of the cable stations forever, like,
That's
just
amazing.
just post up, got my water and everything, but
I think right now, like, I don't have access to one, so if I saw, like, a stack, like, cable, I would be like,
mhm.
"Okay, like, what can I do with this?" Because, like, I'm gonna take this all in, you know?
Yeah, you gotta be able to do it whatever you can. I know those Kaisers are something else. Those are interesting. I don't know if I like them as much
Yeah.
as just like a typical weighted. So I actually trained for 2 years at the old Functional Patterns headquarters.
Ooh,
Yeah,
very
and
fancy.
that was in Seattle. It was a super nice little like setup they had there, but they had I think like 6 Kaisers just everywhere. I mean, that's like
Wow.
their staple is like using cables. And I mean, it was a crazy piece of machine. Like you have to like pump it up and it makes all this noise.
Yeah.
And I was like, geez, this is nuts. But
Yeah, there's it's hard because with one of those things, like, the calibration really needs to be on point. Like,
right,
over time, like, how do you actually know that you're lifting, 30 pounds of pressure? Like,
right.
it could change, right? Where it's like a stack, it's like, you're lifting 30 pounds. The one thing I do enjoy with those is, like, resistance on the way back. So it's not like a typical cable where,
Mhm.
like, you pull it down and it just, like, flings you back. Like, the cable, the Kais are super smooth and resist you, like, on the way back as well. Um, the last place I worked had a Kaiser leg press,
Ooh,
and, I mean, of course, the price is, like, too
insane.
much for me, but I swear
Yeah.
if I had enough money, that's what I would get because, of course, you can adjust the pressure, and I have, access to a leg press here, and, like, you push out, and it, like, is 0 resistance on the way back. It almost just,
Mm,
like, slings you back in, like, at that top position. It's like you don't even have any control of it in some ways. The leg press was, like, smooth resistance out, smooth resistance in, so you could do, like, heavy eccentrics on the way back,
hmm,
and then also make it really light so you could do, like, speed and power reps without having that kind of uncontrolled feeling at the end.
gotcha. That would be super versatile.
Yes. I mean,
Like,
that's I would say it's the worth the price of admission, but I don't know if I can
right.
truly say that if I'm not doing that.
Well, and if you look at some of these people again, like functional patterns, they'll say that is more functional to have that type of like a pressure system and all that. I don't
Yes.
know. I don't really subscribe to that, and I don't know if you do, but yeah,
It's
it's
all language, right? It's all branding, it's all marketing, right?
100%, 100%. And anyways,
It's
no,
not all bad, but yeah, you just have to kind of keep that in mind, you know? It's like
exactly.
I feel like that's where my head has gone and a lot of like my learning has kind of adapted to. Um, but it's just funny because people could say the exact same thing, like I just said prior, and you just have different like words that you use because you want to be special, and like the people you work with want to have a unique language, maybe, and that it makes you stand out. So I
Exactly.
always, I always just think of things like that when I hear stuff.
It, it's marketing and fitness is not I don't enjoy the combination
Yes,
anymore,
that's a good
especially like
point.
going through because well, one, I was such a sucker for so much of it myself. Like going through, I was like, oh, I need this, I need that program, I need that certification because that's gonna just set me up and I'm gonna be the best of the best. And then it's like you get to a point where you take so many courses and it's like, what do you even call this anymore? Like it's still a human body
Mhm.
at the end of
It's
the day.
more so just yeah, exactly. It's just like everything in life, right? You could relate this to a lot of things like politics, so on and so forth. Of like, if you're so deeply ingrained into one thing, that's a problem.
Right.
Like in my opinion. But then if you're too far out in space where like nothing matters and nothing makes sense and you have no idea what to do, you're also in trouble. So it's the same thing in fitness of like I wanna dive down too deep in something, but then I would have, something that you can latch on for your values and to guide you. So both are kind of dangerous.
Right. What do you think about, and this is a woo-woo question, if you would, but someone's thoughts and beliefs displaying themselves through movement. You know, I find that
Oh,
I know, right? Like, well, I find that, I watch because I'm sure you've seen hundreds and hundreds of people move and how they move, and then the personality that's behind that person. And there's small little common things that you notice. And it's like, man, like, is this person they're so stiff, especially from like a PT setting. Like I'll work on a patient and I'm just like, man, this guy is the stiffest person in the world. And talking to them is the same way. I'm like stretching them out or something. Like the first time their glute has actually felt any stretch in 20 years. And I can
mhm.
hardly talk to the guy. I'm like, okay, this is awkward. But I'm just curious, like, what your opinion is on that. Like, I think that's very anecdotal, maybe on my part, but if you've seen anything similar.
Yeah, I think everything is connected. I think there's much deeper things and strange things to us that we can't even begin to understand about
Mhm.
ourselves. I think restrictive thoughts can lead to restricted physical symptoms or expressions, and vice versa. Um, I mean, I remember an experience I had. Oh my gosh, I can't believe I'm Mike T. Nelson, thank you.
Mhm.
Did I think it was an RPR session with me when I was at Ben House's retreat. And like, I just remember I didn't realize I was doing it. He pointed it out to me, like staring at the ground all the time and just kind of restricted in my movement. And I went through the session and the colors visually changed for me. Like I could see things much more peripherally. Everything was brighter. Um, I instantly had a smile on my face, and everyone was pointing this out to me. Like I wasn't like really aware of it at that time, and my walking just instantly changed my mood. So it's I think everything's kind of connected. Um, and it just depends on like what point of intervention that you kind of have access to could probably change a lot of other things in someone's life.
Yeah, totally. I think in some cases, like just it's hard too because if you have someone like say who's in that case, and it's like, well, go outside and walk.
Mm.
Like, is that really a good beneficial recommendation? Like, they still probably in a shit mood and still probably going to stare at the ground to some degree. It's a tough. I think changing the environment can help with a lot of that, but I think there's specific interventions that you can apply, which now we're at the end of the show, and it's like we're not going to talk about these, but
I know, right?
until
We
next
should
time.
definitely do this again. We probably should have done it at like a point where we could have more time to expand. But yeah, even someone going for a walk and just saying, look at the horizon
Right.
on the trees, or like glance around you once in a while.
Mhm.
Um, a person I would highly recommend that people kind of get into, which is hard to say because it doesn't really put that much stuff out, is Seth Oberst. He kind of dives deep into a lot of the stuff as you're aware. And he's a kind of great point of reference for innervations on a somatic sense that can relate to people's past experiences. So it's just like an interesting exploration, probably into that very specific question.
Right. No, I've seen a lot of. I actually really enjoy your all's posts, like yours, Zach's, Lucy Hendricks. Like you all kind of talked to him for a while, and then he's
Yeah.
stopped. He's disappeared. I don't know what's happened to him. Like,
he's
I'm
he's
gonna
a
reach out and see
good
if he'll get on the show. Like,
you should.
yeah,
He's a good friend. He's actually going to speak at the seminar I'm putting together, the Boston Health and Performance Summit in June in Boston. He's going to be there for a speaker, and I think I suckered him into it. But
there you
yeah,
go.
he's not like I don't know, public outputting is probably not like a big priority for him. But like
Mhm.
I'm slowly gonna get him to do that, Kyle.
There you go.
Slowly.
Well, thank you so much, Michelle, for doing this. Again, sorry people for not going into full detail on that last question, and but well, like I said, you have to listen in next time. But no, if you want to hit us with where to reach you if you would like to be found, and we'll call it there.
Perfect. Yeah. So I post a lot of stuff on Instagram. That's at dr.michelleboland. And then my website's pretty easy. It's michelleboland-training.com. Those are probably two like best avenues. You can definitely get in contact with me. But honestly, thank you so much, Kyle. Like this was super easy, fun. I mean, I feel like I could talk to you probably for the next 3 to 4 hours.
Right. Yeah. And I'm going to plug in for you your own exercise database. Definitely check that out. I have it. It has been amazing. I really like using that. And it's definitely shortened up my own programming because that can be a long, tedious process at times.
Yes, exactly.
If you're a coach listening to this. But no, thank you so much for coming on and we'll see you next time.
Yeah. Thanks, Kyle.